morning.
Morning.
Morning. Have you ever had an experience that changed your life so profoundly that it was never the same again?
Yep.
September 11 impacted the world. It also impacted my life. When I was summoned to my boss's office, I had no idea why as I made that anxiety-provoking trek from my desk down the hall. A little voice in my head said, "It's probably nothing bad. I can't remember any major screw-ups that I know of." 10 minutes later, I was packing up my desk, wondering if my coworkers were noticing and hoping I didn't choke up as I said goodbye. I had 15 minutes to pack up my desk. I was working in the financial industry when September 11th happened. And it affected many people very profoundly, and it certainly distressed the financial markets. My company laid off a large percentage of its workforce, and being a newer hire, I was one of them. A year later, the company folded. At this point, there weren't too many jobs in the investment industry, so I took a mental inventory and thought, well, what do I really want to do? I'd always been interested in health, exercise, nutrition. How many people have had parents that smoked when they were growing up? Okay. My mom was a smoker, and in her early 40s, she decided to quit, and she put on some weight, and that motivated her to go to Weight Watchers. So then she lost weight, she started running, and she took me to the gym with her. And that kind of started the healthy spiral. So I guess I was kind of inspired by my mom. My dad also smoked, and he was a bit overweight, had high blood pressure, he had back problems, but he never wanted to undergo surgery. And he was an orthopedic surgeon. So he did inspire me too. He's very conscientious with his. So when I was working actually in the industry, in the financial industry, I took a massage therapy course, and I started practicing therapeutic massage when I lost my job. So this is kind of interesting. I like helping people, and so I wanted a little bit more. So I decided to shadow a family doctor, a physical therapist, a couple physician assistants, and a couple chiropractors. The family doctor seemed to spend little time with the patient. And then the physical therapist, well, she needed a prescription from the doctor to actually treat patients, so I thought that was a little limited. The physician assistants I saw basically doled out medications to patients. Some of them came requesting specific ones by name. I thought the chiropractor had an interesting scope of practice. You could do manipulations, also known as adjustments. You could do a little massage work, a little soft tissue work. You could prescribe exercises similar to the PT, and you could give nutritional advice. Right up my alley. So I decided to go with this particular approach. Plus the theory to me made sense. You have the spine, and inside it houses the spinal cord, and then out of there it exits the nerve roots. And they go to different parts of the body. They can go down the legs, they can go into the arms, they can go to the organs. So it seemed to make sense that dysfunction in here could impact other parts of the body and the nervous system. So that made sense to me. When I was in chiropractic school, well, actually I had a few doubts. The mechanism of the adjustment the chiropractors do, isn't completely understood, like many therapies. But research is giving more information. But however, some people have had amazing results. When I was in chiropractic school, I was studying a lot, sitting at my desk, sitting on my bed, sitting at the computer, sitting in class, and I started to have neck pain, especially when I turned my head to the right. And then it would travel into my shoulder. One of my professors, who was a chiropractor, adjusted my neck and my first rib area, and instantly I was 90% better. I had improved range of motion, I had decreased pain, I didn't have that radiating pain. I had been adjusted before, but since I was relatively young and healthy, I hadn't had a pain issue to address before. So this was the first personal experience beyond the theory where it seemed like it impacted me, that this stuff really works. Naturally, too. How many people can identify with this woman? She said, the pain starts in my husband's lower back, travels up his spine to his neck, then it comes out his mouth and into my ears, and that's why I get these headaches. About 80% of us will experience back pain at some point in our lives. The remaining 20% of us will know someone with back pain. It is the second most common reason for visits to the doctor's office. Can anybody guess the most common reason to go to the doctor?
Say that again.
I said the back pain is the second most common reason people go to the doctor. Can anybody guess the most common reason people go to the doctor?
Stomach pains.
No, not actually. What would you say?
Neck pains.
No.
Headache.
Cold.
Yep, common cold, upper respiratory infection. Yep. And did you know back pain is a leading cause of disability in people under age 45? So there are two main types of risk factors for back pain. Those related to you, the person. It could be your postural imbalances, your genetics, your conditioning, how in shape you are, and then also those related to the demands of the task. If you're going to lift something, if you're bending, twisting, if it's repetitive motion, those types of things. This presentation looks at ways to address both types of risk factors by increasing your awareness of how and when you move, and then by also increasing your stability in your back. Sorry, I don't have a clicker, so I kind of keep going back and attacking that. That said, there's no magic bullet. Some of us will have to manage back pain ongoing. I have a patient, Frank. Frank is 63 now. He came to me about 6 years ago. Severe back pain into his leg, the back of the leg, sciatica is how it's known. He had hurt himself playing football with his son on the beach. And he went to see the orthopedist, got an MRI, he had disc herniation at L4, and was recommended surgery. And he didn't want to get surgery. So he came to me, I treated him. It took a little while, but eventually he got out of pain. But now Frank sits too long at his desk or does too much yard work. Look at a little reminder, a little bit of a pain down the leg, a little bit of ache. Nothing as severe as he had before, and it doesn't last. And that's because Frank is religious. He will be at his desk at work, take a break, drop to the floor, do push-ups, do his exercises, and he's incorporated this into his daily routine. He doesn't even think about it anymore. And he did drop some weight too, so he's able to do all his activities, ride his bike, play tennis with his wife, and actually I think it was just this week he went on a trip to Spain for a couple of weeks. So. This guy says, what's the difference between being addicted to painkillers and just really, really liking them a lot? So some people may want to manage their pain in a more natural way. We've had a lot of things in the news about addictions to painkillers lately. So before we get into that, let's talk a little bit about the injury process. So when the load, if you're picking up something or the load exceeds the strength of the tissues, failure occurs, or failure or injury is what it's known as, occurs. That can happen with a one-time heavy load, like this guy lifting this box, or with a traumatic event, like this mountain biker here. But more commonly, it happens with repeated sub-failure loads. So this woman is carrying out multiple flower beds, or it could happen with a sustained load of a long duration, like this construction worker bent over in that position for a long period. However, the rate of failure or injury could change if they took a break. You know, if this was interrupted. I love that picture. So I keep talking about loading. Anytime there's contraction of the muscles or you're working against gravity, there is compressive loading of the spine. Now we need some loading for to bring nutrients to the discs. The discs are in between, I'll talk about them a little bit more, but they're in between each vertebrae. So they don't have a big blood supply, so the way they metabolize and nutrients come in and waste goes out is through motion. It's called inhibition. We also need loading in the form of weight-bearing exercises to ward off what? Anybody tell me? I think I hear it. Osteoporosis, yes. Can anyone give me an example of weight-bearing exercise? Don't be shy.
Plank.
What was that?
Plank.
Plank, yes, that would be weight-bearing. Did anybody think of anything else?
Push-ups.
Push-ups, yep.
Squats.
Squats, yep. So even walking is considered a weight-bearing exercise. Now, according to the National Osteoporosis Foundation, they recommend weight training about 2 to 3 times a week, and then just weight-bearing exercise in general about 30 minutes most days of the week. I guess that means 4 days most. Yes. Oh, feel free to ask questions too.
I know that that disease occurs in certain people more prevalent than other people,
Yes.
but I know a person that holds their body in a hump, slump position like that. They've held it for so long that they now have, it's like an actual hump
Right. Right.
in their
Repeat the
back.
question.
Yes, she was saying that she knows someone that has assumed this position for a long period of time, and now they're kind of stuck in that
They're
position.
stuck
pretty
in
much,
that
yeah.
position. If the body is actually hard, you know, instead of being, because sometimes that disease, as I stated, occurred in certain people more prevalent than other people.
Right.
But this particular person has just carried herself in such a way of being, you know, slumped over, and we think it's not important, but it is important to have good posture.
Sure, it is,
Because
yeah.
the continuation over the years, she is now round shouldered, there is a real hump in her back, and there's really nothing, I don't think, unless it's surgery, you're the professional, but to correct that at this point.
Well-
And it's such a shame, because now she's saying, what can I do?
Yeah, yeah. Well, it can be a combination of things. So a lot of times when people get osteoporosis, what happens, the bone demineralizes, so it loses some of its strength. And so, and then you can also lose the height of the discs in between. And that can start to, the bone isn't as strong, and you start to kind of creep over. Sometimes even the vertebrae can fracture because it's so weak, and then it's like a pancake. So yeah, I mean, at some point degenerative changes, they can be reversible, but at some point they're really not. But if generally movement will help, you know, people a lot of different things. So just a little bit about anatomy. This is, I guess I can use the mouse. So this is the vertebrae here. This is the disc, the intervertebral disc. And they give the analogy usually that this is like a jelly donut. So you have an outer doughy part and an inner jelly type part. And so that goes in here. Then in here is the spinal cord. You can't really see it, but what you do see are the nerve roots that exit out. And so depending where the nerve roots are, you know, if it's in your lower back, they'll go into your leg. They can go down the back of the leg and then the front of the leg. If this is in your neck, then the nerve roots go into your arm. And then also from the spine originates the roots that go to the organs. Where the top vertebrae meets the butt vertebrae underneath it, like in here, which you can't really see too well, it's called the facet joint. And then we also have various muscles and ligaments that attach to the spine. So any one of these structures can have an injury. If it's an injury to a vertebrae, it's usually some type of compressive force, like an accident, fall off a ladder, car accident, something usually with good impact. If it's an injury to a ligament, it's probably a slip or a fall that's going to maybe tear that ligament. Muscles can be strained from overactivity. We're familiar with that. And then the discs, usually with repetitive flexion, so bending, that can push the disc material out and back. Sitting is also considered flexion. And then, the disc can push out and hit the nerve root. Let me show you the next slide. So this is a normal disc. This happens as we start to get a little bit older. It starts to degenerate. So we get a little change in the fibers of the disc and it loses some height. This is the bulging disc. So that's when the doughy part pushes out back a little bit. You get a bulging disc. Have you guys heard that term? Okay. The one below it is a herniated disc. So that's when the jelly material pushes through the doughy material and bulges out the back. And that can, either one of those can press on the nerve roots that come out and cause pain to the legs or to the arms. This is a thinning disc, and then we start to get some degenerative changes, especially when things aren't moving so well, and a little arthritis. So we start to get what they call osteophytes, so like little bone spurs, and we get this ridging. So when we also lose disc height, this is the little circle where the nerve root exits the spine. So when we lose that disc height, that circle becomes more narrow, and that can cause stenosis, and that can also pinch the nerve root. So do you think, looking at some of these vertebrae discs, they might not be moving quite properly at this point if you have one of these conditions? Maybe some of the biomechanical integrity is a little bit off. Usually as we get older, we get a little bit less mobile. We might have hypomobility. So that can have various effects, including pain. You have different, or a lot of people say, I really feel better, I have back pain, but when I move around, I feel so much better than just sitting. And that's also why you're stimulating those mechanoreceptors, you're getting things moving. Does that make sense? I know I'm throwing technical terms out. Did you have a question?
I was going to go back to that picture for a second.
Sure.
Just turn into a degenerating one before it goes into a bulging one, before it herniates, or are they all different?
That's a good question. Yeah, not necessarily in that order. I mean, you may never get a bulging disc or herniated disc, but as you get older, it will probably thin a little bit. You may get some degenerative changes. So it's not necessarily getting that.
And let's go from top to bottom. So does it naturally happen more in your lower portion of the back as opposed to the higher portion
Well,
of the back?
actually, the disc problems, disc herniations, and bulging discs are more common in L. So you have 5 vertebrae in your lumbar spine. So most commonly you have problems at L4 and L5 because that's where the most motion takes place. So they tend to have the most issues in its lower vertebrae. All right, so now how do we do some things to counter this? We're getting to our tips for the healthy back. The first one is to maintain a neutral spine. So here we have 3 illustrations, just like Goldilocks and the 3 bears here. So the natural curve in your back is called the lordosis. So this guy has kind of an extra curve, a little bit hyperlordosis. This guy's pretty flat. He doesn't have much of a curve. And this guy's just right. It's got a little natural curve. So why is this important, the neutral spine? Well, this is the way your back is designed to function to its optimal. So you want to maintain that neutral spine. So I can have everybody stand up. And then just lean forward. And then put your hands on either side of your low back, on the either side of the spine. Okay? Do you feel, because the neutral spine is the way everything is designed to counter gravity as it pulls us down. They're in a more biomechanically effective position in neutral spine. When we start to flex a lot, it pushes the disc material backwards and we're at risk of getting that bulge out the back. And then it can press on the nerves and then you have a whole slew of issues. So repetitive flexion to the end range is the easiest way to herniate a disc. I might see that go on. Here's another example of a flex versus neutral spine. Anybody go to the gym and do squats? Okay. All right, so if you can see it very subtly, this guy has a little bit of curve back there. His butt is tucking under a little bit. They call that the butt wing. We don't want it the butt wing. We don't want any butts winking at us. Okay? Because that's creating a little bit of flexion right there in that lumbar spine. This next picture, there's some extension, which is kind of compensating the other way, but a lot of people don't even have that flexibility in that upper back. So I'm not so worried about that. And then here we have the neutral spine. Look at that, isn't that beautiful? They did a study of power lifters, wondering how these guys can lift so much weight. And one of the guys actually herniated a disc right during the study. And they realized what happened was he had increased flexion in that lumbar spine, like that first picture. So you really want to watch the way you're moving. If you're doing squat at the gym or if you're doing a squat in real life. So if he's carrying a weight on his back, he's going to have added compression and force on his lower back too. So here's another version of neutral spine, although she's not bending her knees, but she's still keeping her spine neutral. So she's hinging about the hips here. And again, here we have flexion, bending, to the end range. You can't really bend any further. With a load, that's the easiest way to herniate a disc. So we want to maintain a better posture while lifting. There was a doctor called Dr. Michael Schaefer. He developed this power lift training system, which is really geared towards more industrial type workers, but we can pick some tips up from that. He has 5 basic lifts that he recommends, and he says, remember, lift like an elevator, not like a crane. So I like that. The first one he talks about is the wide stance lift. So if you're keeping your feet, hip width apart, you might not have the flexibility to bend down as far. So you might need to widen your stance a little bit. If you're approaching a box or something it might be easier to come at it from the corner, and then you might even need to stagger your stance a little bit. And remember, lift like an elevator, don't bend like a crane, keep the chest open. And then in this picture, he's tipping the box toward him to create handles. So that helps create handles for you to carry and maneuver the box a little bit. If it's a bigger box or it's more awkward, you might have to tip it the other way. This picture here is the tripod lift. It's good for accessing things maybe on a low shelf, because how many of us come and do this? Okay, that creates a shearing effect on the disc. And I keep talking about disc because between 30 and 55, that's when it hits most of us. So for the tripod lift, you get a base of support of the knee, the foot, and the back foot, and then you put the load on your thigh, and then use that to push up. Now, if you have knee issues, that might not be the best thing, or you might use a kneeling pad, but it can come in helpful with gardening, or even if you're not picking something up, just pushing up from a kneeling position. And then this is the golfer's lift. How many people have seen Tiger Woods or the other golfers? They have their golf club and they're reaching to the hole. Maybe not Tiger Woods so much anymore, but some of the other golfers, and they're using that golf club as something to lean on, and then they have the back leg as a cantilever, so it kind of counterweights their leaning. Here's another couple examples. So if you're using something to lean on, you want to use the hand opposite the standing leg, so you don't twist it back. Okay, don't do too much of activity. This is in our next tip. Don't do too much of one activity. Studies have shown that workers have had more back pain when their jobs were either sedentary or involved heavy lifting. And they had the least amount of back pain if they had moderate activity in their jobs. So, maybe now here, sitting is the new standing. Sitting is the new smoking. So rates of diabetes, obesity, heart disease can be doubled or tripled if we sit a lot. So we want to counter this. You burn about 60 more calories standing versus sitting. So one way to manage sitting is obviously to stand up. So if you want to stand up again, that's the interactive workout. Okay, and then of course exercise. Okay. Avoid strenuous activity after prolonged sitting or stooping. So this means if you go for a long drive, say you're on a road trip, you want to immediately get out and pull your suitcases out of your car? Probably not. And that's because your back has been in that position for a long time. It's not been in a neutral spine position. It's been in a flex position for a long time. So again, it's not in the most efficient position to lift. So if you go and pick something up, you might hurt the back. So it's best if you do your road trip, stop, get out, go to the bathroom, walk around a little bit, then come back later with the suitcase. Avoid lifting or bending just after rising from bed. The discs are the most fluid filled after overnight rest. So you're tossed in the morning, and your disc bending stresses increase by 300%, and your ligament stresses by 80% in the mornings, because everything is pulled the most taut in the morning. They did a study of low back pain sufferers, and in this particular group, all they did was eliminate bending and flexing in the morning, and they actually had some improvement in these back pain patients. Yes?
When I get up in the morning, I find great relief with my back pain by sitting on the edge of the bed and then touching my ankles and I hold that for a few minutes, it
Uh-huh.
does relieve my back pain.
Well, this study kind of applies to the general population. Not everybody's going to be the same. And then sometimes if that might relieve it at that point, but if it's done repetitively, it might have accumulating effects.
Does that mean not stretching in the morning in the sense of the bending stretches?
That's a good question, too. With this study, it was bending and lifting. So, yeah, bending stretches would fall into that category, yeah. But again, some things might apply to the study group, but you might be, an exception to that. Stabilize the spine even during light tasks. So what is stabilizing the spine? If you picture a fishing rod standing upright and you put a weight on top of it, what's going to happen? Flop over, right? If you attach wires to it, guy wires or a tent, you pull those wires tight, it creates stability. So your muscles are like the wires, and then your motor control system and the nervous system are assured that those are symmetrical. There's symmetrical tightness, so it doesn't buckle. So the way we create that tightness or that stability is through bracing. Now bracing isn't sucking in your gut or hollowing it out. It's just about a 10% contraction of your abdominal muscles. And that automatically fires your back muscles. This engages your natural back brace. And we need to keep that back brace active through the activity that we're doing, if you're bending or lifting, because people tend to fail and have that injury not from lack of strength, but from lack of endurance. They did another study of low back pain sufferers, 1,000 low back pain sufferers, and they found that injury was 25 times higher in those who got distracted during an activity and they weren't paying attention. So stabilization exercises facilitate this stability. This guy says, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? We gotta get our exercise. The National Institute of Occupational Safety and Health has set a limit for low back pain compression at 3,300 newtons. Newton is a measure of force. Anybody remember that from physics? Repetitive loading above that level is linked with higher injury rates. Yet our traditional sit-up imposes about 3,350 newtons, which is why you see a lot of people doing planks, more planks now, and crunches and things like that, rather than the sit-up. And then Superman is at 6,000 newtons. So if you have back issues, a lot of people do these thinking they're strengthening their core, and they are, but there might be other choices that also strengthen but impose less compression. One example would be like the curl up. Here she's got one leg bent, one leg straight. That reduces the flexion in the spine. She has her hands under her low back, and then the fulcrum is the chest, the sternum, and the head is in line with the spine, and she's engaging her brace the whole time. The bird dog, you might have seen this or done this in yoga. So you're engaging your brace, you're lifting opposite arm, opposite leg for about 6 to 8 seconds. You want to avoid torquing or twisting the back. And you're trying to facilitate the endurance and strength of these back muscles. Then we have the side bridge, another excellent one. This really strengthens but imposes no flexion really on your back. So you want to make sure elbow is under the shoulder. This is the modified version on the knees. The regular version, you come out up on your, lift the hips and come up on your feet. Try and work up to a 45-second hold. And then another tip is chiropractic care. So a little about the adjustment. We talked about how some loading is necessary for bone health, but also to bring nutrients to the discs. What the chiropractic adjustment does is it induces motion into the joint. And then that can help facilitate the metabolism of the disc, bringing nutrients in and out. Another thing that it can do is, if you have a hypovocal joint, it can also help put it through the range of motion. And that will help stimulate the brain, retrains the brain to remember that full range of motion. Kind of like when we learn a golf swing or some other sports, where it's awkward at first, but then your muscle memory develops and then it becomes more natural. So if you do that adjustment repetitively, and eventually it retrains the brain to remember that mobility again. It can also relieve pressure on a nerve. So you might have pressure from that disc bulge, or pressure from a tight muscle, or if there's an injury, the body might send chemicals there. That's called inflammation, and that can take up some of that nerve space and put pressure on the nerve. So the adjustment, relieves some of that, and that's why people tend to have pain relief after an adjustment. And it can also help you ongoing as maintenance. All right, I threw a lot out of you. Anybody have any questions? Yes.
Okay, so when you go to the chiropractor, it's not necessarily just the back, going up into the neck as well?
Yes,
There's
yeah.
distance for-
Yeah, it depends on the chiropractor, but like if you came to me, I would check the whole spine, and because it's all one, it's all connected. So usually I'll check the whole spine. Yes.
So I've had back surgery for a ruptured disc.
Okay.
That was years ago. But I'm afraid to come back to a chiropractor because I was going to a chiropractor when I needed to go to surgery. So is there anything that there should be concern about in returning to a chiropractor even after having surgery?
I have patients who have had laminectomies. I have patients that have had infusions. So you just kind of, a fusion, you don't really want to adjust that area because it's stabilized, with the surgery. But the laminectomy doesn't usually present that type of a problem. Yeah. And, if that level where you had the surgery is, maybe there's issues there, but there might also be issues above and below. Because that usually happens.
Thank you.
So. Any other questions?
At one point, I did a couple sports, wrestling and tennis. So wrestling, actually there's a lot of impacts. And then tennis, you have some motion that is torquing the back all the same way, like the serve. You're not doing it in opposing directions. It's just one way. How would you, compensate for that? Motions that are in the same direction. all the
Yeah,
time?
yeah. Well, you might be able to do counter stretches, off the court, and stability exercises also can help with that. And then I do active release technique, ART, which is moving the muscle through range of motion while you're contacting it. And a lot of times that can happen, or that can help if you have repetitive motion and the muscle starts to get sore.
The same kind of thing as muscle activation?
That's a little bit different, yeah. I'm getting a sign here. So I wanted to mention to everybody that I have a coupon for a free spinal exam for attending this talk, so I'd like to offer that to you. We also have a packet of biofreeze attached to the long card. It's kind of like an icy hot, so you can rub that on a sore muscle area, has arnica in it, and then it's off. And then whoever got their raffle ticket in. Okay. And then I'll just recap. During daily tasks, remember to maintain your neutral spine. Don't do too much of one activity. Avoid strenuous activities after prolonged sitting or stooping. Avoid bending or lifting just after rising from bed. Stabilize the spine during leg tasks. Do your stabilization exercises. And again, adjust it. Helps with the mobility of the joint.
They avoid lifting and bending just after rising. So if you wake up, it's not good to do exercises when you're still in the bed.
Well, again, that's one that keeps kind of coming up. In this study, they found that reducing spine flexion and lifting in the morning helped back pain patients. You may have a certain amount of flexion that you can tolerate. And if you spend your whole day sitting, or if you're a cyclist and you're in this position all the time, okay, that might be all you can tolerate. So if you're doing bending in the morning, that might help push you over the edge. Does that make sense? Okay, so if you're just doing a little bit, it might not, bother you. But if you have other areas where you're flexing, that can bother you.